Hi everyone, it's Shauna from Pulse Cardiac Health. I wanted to do a quick video today on exercising with angina. It is a pretty big topic. I know a lot of people do suffer from angina pains, so I will try and get a lot of really great information in a short period of time. Don't forget to subscribe and click on that bell so you can get notified when we release a new video. So angina is a term used to describe the symptoms we get when our heart isn't getting the oxygen or blood flow it needs in order to do its job. So remember, our heart has those coronary arteries. Those are the arteries that feed our heart muscle itself. Now, often after we've had a heart attack or we have some known cardiovascular disease, we have some narrowings or blockages in those arteries, which decreases or limits the amount of blood flow, oxygen that our heart muscle can actually get. And so this is when these symptoms might come on of angina. And everybody's going to be different in terms of what symptoms they get, but commonly it's chest pain, might radiate down into your arms, up into your jaw, or into your back. But whatever symptoms they are, they're going to be for you, and you'll kind of get to know, when they come on and how often and the severity and all those types of things. It'll become predictable for you. So in terms of exercising, as we exercise, our demand on the heart goes up. So our heart rate is going to increase, and the demand of blood flow to the rest of our body increases. So our heart has to work a little bit harder. And it's when that heart has to work harder, but still getting that limited amount of blood flow to the muscle itself, that these symptoms can start to come on. And so often this makes it so people don't want to exercise because they're getting discomfort. And so that makes it so our heart muscle just continues to get weaker and weaker, to the point that even maybe doing the daily activities that you do within your day, you start to get these symptoms. So we want to be able to exercise to build that strength in our heart muscle and make it a little bit more efficient with how it uses the blood flow. So there's some things that you can do to make it a little bit easier for you. So the first thing that I want to talk about is a warm-up. So your warm-up is something where you walk nice and slow, or you exercise nice and slow, whatever it happens to be that you're doing, to allow those blood vessels to open up and dilate. They get bigger. And that makes it easier not only for your heart to push the blood out to the rest of your system, because those vessels are nice and big that it's pushing against, but also in terms of the coronary arteries themselves, the ones that feed your heart itself. They get bigger and more dilated, easier for the blood flow to get through to that heart muscle. So extending your warm-up to at least 5 or even 10 minutes of just nice and gentle exercise to allow the blood flow to get going. You might feel yourself start to get warm before you actually make your heart work, and make yourself work a little bit harder, can make it so those angina symptoms come on a little bit later on. Okay, so that's the first thing. The second thing is, if you are exercising and you start to feel those symptoms starting to come on, decrease your pace or decrease that intensity a little bit until those symptoms go away, and see if you can just maintain yourself exercising there. Our goal is to push that angina threshold. That's that term of when it is that the angina starts to come on. The goal is to push that angina threshold back. And so if we're able to exercise underneath that and build the strength and efficiency of our heart as we're exercising underneath that, eventually we'll be able to exercise and do more and more before that angina comes on. Okay? And the third thing is potentially using your nitro spray. So if you've been prescribed nitroglycerin spray, if those angina symptoms are coming on quite early on in your exercise phase, and we want to be able to exercise a bit underneath that, you can take a spray before you even start exercising, okay? And then what that's going to do is it's going to open up those blood vessels so you can exercise a little bit more underneath that, and again, push that angina threshold up a little bit, okay? So remember that this is the type of angina that's called stable angina. It's predictable. This is something that you've had for some time. You know that after you eat a large meal, you get it. You know that if you walk up that certain hill, you get it. It comes on predictably. If for whatever reason that changes for you, all of a sudden you're getting these angina symptoms at random times, the severity changes, this is when you want to make sure you talk to your doctor. The other thing is, always remember that if you have that nitro spray, don't be scared to use it. If you get those symptoms and you use your nitro spray and for whatever reason it's not going away, you want to follow that nitro protocol. So you're going to wait 5 minutes, see if it goes away. Take your second spray, wait 5 minutes, see if it goes away. If it's still not gone, you want to call 911 and take your third spray. Okay, so I hope that was helpful. If you have any questions, by all means, feel free to reach out to us, and we'll talk again another time. Thank you.